So now we are moving to the black fungus story, which we are listening in nowadays. So what is this black fungus, and was it there earlier also, or it came now? So what is the background on it?
Okay, so the first thing is whenever we heard this black, we have got a negative thought inside your mind. The same fungus, if you the nomenclature is red fungus or cream fungus, then it will be a soothing one. So the black fungus, this nomenclature is actually causing all this phobia. So this fungus, actually, this is medically, this is known as mucormycosis. Okay, so this mucor is there. Mucor is there before our arrival. So the fungus are there for they are pretty older than this human being. Okay, the mucormycosis actually affects any person or any organ of a person who are immunosuppressed. So immunosuppressed patient could be a cancer patient, could be a diabetic patient, could be a patient who are on long-term steroid. So these fungus spore are everywhere. It could be inside your book, it could be on the surface of your table, it could be inside your toilet or wash basin. So everywhere there are fungus. We touch fungus spore, we take fungus probe from our hand to our nose or face, but we are not getting affected with this mucor. Why? Because we have immunity to protect ourselves from this fungus. Now, when the immunity get depressed, then there is a problem. In COVID, what happens? The immunity gets tremendously depressed because your immune system is fully organized to tackle your COVID, and it is probably exhausted. So first thing is that. Second thing is you are giving some anti-inflammatory drug, like I earlier mentioned, steroid. Steroid is a potent immunosuppressant. So immunity further depressed. Next, you are taking oxygen, which is probably contaminated. If it is a contaminated oxygen, during this second wave, when medical supply or medical oxygen supply was inadequate, there was a channel where we get oxygen from the industrial supply. The industrial supply oxygen is good. Industrial supply oxygen is not impure. But
Change. Okay, don't see the password now. That is me. Please don't see the password.
Okay, your voice is not coming. Some background sound is there. Yeah, now it is coming.
Now it is coming. Okay, let me.
Yeah.
So where we are still.
Now your video is not there. Yeah, now it is okay.
So we are talking about black fungus. So the industrial oxygen storage, and medical oxygen storage are different. So probably the industrial oxygen storage and supply chain, some amount of contamination has happened during this process, and probably this contaminated oxygen along with immunosuppression are the major reason for this mucormycosis outbreak, or whatever we are talking about, black fungus outbreak.
Okay.
The person who are not admitted, not taken oxygen, and we don't see such kind of cases. A patient with a mild COVID treated at home has got mucormycosis. The major of the mucormycosis victims are ideally hospitalized or given oxygen in hospital, and later on, because of immunosuppression use, they get this infection.
Oh, so maybe your camera can be, you can adjust it.
Sure.
Your face is in the sidewise.
Okay, let me check. This one is okay. No, this one is okay. Which one? Let me check.
Little bit right side, maybe. Move it little bit right side. Yes.
Okay.
No, further. Maybe then left side.
Left. This one.
Further. because it is coming half portion of your face. Yeah, further left. Yeah, now it is okay.
Okay.
Okay, the next question is again related to this, that what precautions, already you have explained that what precaution can be taken to avoid this infection and what standard medical practice to be done if infected.
So
So
once
any note
you,
on
once you are infected or affected with COVID, you have two responsibility. First thing is, you have to take care of your own health, and second is to prevent further spread to the community. So as soon you are getting your positive COVID report or any symptom suggestive of COVID, you need to exclude yourself from the society. So the best method is isolation. Isolation means you need to be within a premises. If you are alone, there is no issue. If you are sharing your house with your family members, so I will advise you to be inside a room, but you continue communication either through your mobile device or whatever possible. So it is frozen. I think I need to make another call. The video is fixed.
sorry, maybe the network got disconnected.
Your
So
video is fixed. So first
yeah,
thing is
yeah.
isolation. As I told, the social isolation is very important so that you can prevent further community spread. During your isolation period, you have to be very upright, and your mental status should be sound. You should not be depressed, because it is very difficult for a person who is staying alone. So your you need to talk to your family members frequently. You need to see uh, could be online videos or anything. You should not read much more about the COVID at that time. What are the points of severity indicator and all these things? What medication we should try? What is the best thing we should do for COVID? Rather, you should focus on your health, and you should pass your time by involving in some other thing like reading storybook and etc. So this is very important. Most of the patients, their mental health are getting immensely affected during this illness when they are isolating themselves in a single room.
Okay.
And second thing is, if you are positive and next some of the family members is having same symptoms, you should get the RT-PCR check for all your family members. That is very important,
Okay.
so that you get early treatment.
Okay. Thank you. Thanks for your elaborate explanations of each and every queries or the questions. And we are at the end of the session. So, any special doctor's note for our viewers, if you have?
So first, I must congratulate you for arranging this interview. I think there will be some benefit for your viewers, and I should advise to all my viewers that if your family members are still not vaccinated, I have seen there is a vaccine hesitancy, which probably we have not discussed in this platform. The vaccine hesitancy is still there. Many persons who are not vaccinated because of phobia, because of the phobia of reaction of any vaccine, maybe a heart patient or diabetic patient. So don't uh, don't follow all these rumors. Okay, all these vaccine, whatever available in your country, are very safe. We have seen more than thousands or lakhs of patients in my hospital without any single major side effects. So
Okay.
go ahead for this vaccine and stay safe. Don't forget to maintain all these COVID protocols, like maintaining social distance, using proper mask when you are going out. And whenever you are getting any symptoms, at the first day or second day, consult your doctor or hospital, get your RT-PCR check done, and treat early so that you can avoid any serious illness or any hospitalization. Thank you.
Okay. Okay. Thank you. Thanks for providing your precious time. So hope we will meet again with some another session with some another topic. So thank you. Thanks for joining.
Thank you.
Thanks.
Thank you. Namaste.